I would say that we haven't had the technology to determine eyelid disease and its extent in the individual patients. And Clearadex has changed that dynamic for us. Blepharitis can wax and wane, which means it comes and it goes. And many times the patient isn't even aware they have a blepharitis, especially if it's a low-grade blepharitis. However, the collarettes that form around the eyelashes, the debris that falls into the tears, it affects the quality of the tears and affects the quality of vision. I have never had a product like Clearadex available to use, and Clearadex has done an absolutely amazing job on our patients who have blepharitis, which is relatively common. Clearadex has been absolutely amazing in my practice. Absolutely amazing product. It's probably, in 34 years of practice, it's probably the best product that I've ever come across from the perspective of not in the efficacy, not how well it works, but in so many patients you can help that you couldn't help before. The benefits that a Clearadex patient experiences from using Clearadex on a regular basis is much more dramatic. The benefits are more dramatic than the improvement of a simple allergy, which causes maybe a little bit of itchiness or some redness or watering. The patient doesn't realize how much more comfortable they can be once that Clearadex controls the eyelid diseases. I have patients now who I did not know had lid disease, but because of their symptomology, I used Clearadex on the patients, and those patients, their quality of vision has improved. Not their ability to see, but the quality of their vision, which means their eyes are more comfortable, their eyes don't bother them in the afternoon, they don't bother them later on in the evening. Clearadex is, in my personal opinion, I'm very excited about it. I think that you have an absolutely amazing product there. Clearadex has already changed how I practice and how I treat my patients. And excuse the pun, but it's changed the way I look at my patients as well. There are particular conditions where the steroid treats the symptomology, the symptoms the patient has. Clearadex treats more of the problem. It treats the problem and not the symptoms. If you address the problem, you don't have the symptoms. And I believe that Clearadex can eliminate enough of the factors that contribute to some of these problems our patients have and eliminate the problem. And therefore, the patient does not need the eye drops or the steroid for the symptomology because the symptomology no longer exists. Anytime I can use a modality of treatment with limited or no side effects like Clearadex, I'm going to use a product like Clearadex because risk is always, you always have to consider risk in treating your patients, and there's always risk in any type of treatment. But I like the Clearadex product, the fact that there's almost no side effects at all. Eye doctors have an opportunity here to improve the quality of life in their patient, no matter how subtle the doctor may think it is. Don't assume. If your patient has subtle symptomology, no matter how subtle it is, and you think you could improve the quality of their life by the comfort of their eyes, why not? Try it. The patient's reactions have been from, I like it, to this is amazing. And when you talk about a patient with chronic blepharitis, and they've had it for several years, they know it's a problem because it's waxing and waning, it's coming and going. And now they don't have to worry about it for at least a year or 2 years, or maybe even the rest of their life because it may have been eliminated. Patients love it. It's a game changer in practices as far as practice management and patient communication. For something to come up like Clearadex that has low risk and yet has such a wide spectrum of treatment for different types of conditions for our patients is amazing. And Clearadex, I believe, is going to be a game changer at how doctors look at lid disease and the prevalence and incidence of lid disease. Clearadex has changed the way I look at the scope of practice. and how I can treat my patients and to what extent and depth that I can treat problems with my patients. I would recommend Clearadex for any patient who has problems with their eyelashes, because now we're talking about blepharitis probably, but I would go even further, and I would recommend Clearadex for patients who have what I believe to be, I'm not a dermatologist, but what I believe to be skin related and around their eyes or their eyebrows. Even on some patients have skin conditions around the cheeks, rosacea, things like that. I think we're going to find out that Clearadex works on a lot of those conditions. Clearadex seems to be helping these patients. Do they suffer from eyelid disease? You know, you can't make a blanket statement like that. Does eye disease play a role in their symptomology? Probably. Does Clearadex work on eyelid disease? You bet. So I'm putting both of them together. I'm using Clearadex, and we're trying it on some of these patients, and it's working. You're crazy if you don't look into this product for your practice. That's how good Clearadex is. I'm very excited about your product, and I believe that doctors really, really need to look at this and consider it bringing into their practices as a form of another modality of treatment. You're not going to use it on everybody, but I think what you're going to find out is you start using it for some of your patients, and you might try it on 3 or 4 patients, and then all of a sudden you're going to start getting excited about it too. And pretty soon you're not just trying it on those 2 or 3 patients, you're using it on a regular basis on a significant percentage of your patient base in your practice. What I like about Clearadex is I can now treat patients that I would not have prescribed medication for, but it allows me to treat these patients with a product, Clearadex, that has low risk and almost no side effect.